Hello, everyone. This is Raj, Doctor of Physical Therapy, and Dr. Ryan Perron, physical therapist, is also with me today on live. Um, if you are joining this live stream, please post your questions or just say where you're watching from, and we would be happy to. It will be exciting for us to know where you are living and watching these programs. If you're watching it after live session, a recorded version, please do comment. As you know, the name says senior citizen well-being. Our topics are related to elderly people, older adults around the world, and we are our focus is to bring different topics of quality of life. So it will be entertainment as you if you are following us on Facebook group, especially we have so many funny things. People enjoy those, funny posts from other Facebook groups, and we have education on physical wellness, health and well-being, mental wellness, and we are trying to develop these programs to make our followers watch these and enjoy their life. Whatever, we really appreciate your time following us on Facebook and YouTube and different programs. So our focus, as I said, will be health and wellness, quality of life, and we don't have any borders. We are going live, and it's all over the world. So we want to make sure um, our topics are generalized. We do not recommend any particular individual to do these exercises, because it can be risky if we teach you balance exercise and you're doing those exercises. You may be at risk for falls. So you need to be supervised by a physical therapist or a healthcare professional. So whatever we talk about in these live sessions or any of our channels, it's more generalized to help you, motivate you to improve your quality of life. And today, Ryan and I, we were just talking before this live session. Mindset is the key to how you're going to live your life. Um, I have seen so many patients that are 70, 60, even 45 years old. They were in a nursing home thinking that their life is over. They're on disability, and they can't even get up and walk 100 feet. So that's the mindset. We when you think you don't have anything to do at younger age, like 60, 70, if you really think about it, that is still young. 67, I have a client that is 90-year-old, and he travels all around the world. They travel to Asia, they travel to Europe, and his wife is younger, but so they both help each other and travel around the world at 90. And when I see him walking into my clinic, he's unsteady. I feel like he's going to fall anytime. He doesn't even want to use a cane or walker or anything, because he's that motivated. His mindset is that he can do it, like, without falling. So he's that confident. And that's the reason mindset is the key. So if you're, whatever your age is, if you're at 70, think, consider you are going to live for another 20 years, and to 90, how are you going to live? How do you want to live your life? Do you want to be sitting in a chair most of the day, or do you want to be out and about, moving around more often? So that is the mindset I'm trying to motivate my patients. And the same with Ryan, I believe. Ryan, could you please talk about mindset? What do you think? The mindset, how big of a role it plays in somebody's quality of life.
Yeah, I think mindset is probably one of the biggest factors that will influence outcomes. And what I like about it is our mindset is something, we have control over. And sometimes we get caught up in situations that take control over us and feel like we're done in or this is it. But if we can approach things in such a way that, okay, I'm going to take control of the situation and not let the situation take control of me. And one of the big things that will impact that is our mindset. And where we get started with it, I just tell folks, hey, just focus on what you can do and stop thinking about what you can't do at the moment. And if we go about spending our time just doing the things that we can do, the body does respond to that. And I mean, we're not going to get it back as fast as we want to get something like from Amazon. That's not going to happen. There's that biological time clock that we have to help nurture and help it to progress. And so, that's controlling the environment, putting it in a good environment. And we want our mindset to be in a good environment. And that will really help us get somewhere and get that outcome.
Yeah, great. Thank you. So let's change the topic and talk about some of the questions that came up during the group sessions. And somebody was asking how effective are stretching exercises in treating sciatica and its symptoms. Do you have? Do you want to?
Yeah, a
Yeah.
lot of, yeah, sciatica. I mean, that can be a number of like the diagnosis, where is it coming from? Is it somewhere in the back, like narrowing of the foramen, intervertebral foramen stenosis, they call it? Is that causing it? Is it a disc bulge? Sometimes it can be the muscles that it runs through or runs around, particularly the piriformis muscles, which is a deep muscle in the buttock. And but a stretching of that muscle can be effective, and there's certain stretches to help with that. Um, but again, it depends on how the person's hip joint is it going to tolerate that stretch. But I find one that kind of really helps with everything is like sitting on a tennis ball, finding that spot where it's just like, okay, yeah, I feel that. And just that pressure, a certain amount of time, around 30 seconds a minute, at that constant pressure helps to release that muscle, and that gives that muscle a sense of stretching. So that can be helpful. And then there's other muscles in the body, the hamstring, they can react, to what's going on. So they need to be stretched out too, and that. So, but then again, sometimes we think, oh, I want to stretch my back and whatnot, which if the culprit is a disc bulge, then we don't want to stretch certain ways to, increase the onset of the symptoms. So,
Sure. Yeah, I think as you brought up a really good points. The piriformis is kind of like a band, as it's a thick, maybe an inch thickness, and the sciatic nerve goes under the muscle. Even sciatic nerve is also wide band-like stuff
mm-hmm,
nerve, so it goes underneath. Stretching that sciatic muscle, piriformis muscle, is very important by bringing your knee to the opposite shoulder. That's the effective stretch, pulling your knee to the opposite shoulder and holding for about, as you said, 30 seconds to a minute, 3 times. That will be very effective for sciatic pain. And it is the best, treatment for sciatic pain. In general, as we were talking about mindset just before starting this topic, I think mindset, it plays a big role in the stretching. I do practice yoga. I have been more consistent nowadays, and I think if I practice personally as a physical therapist, I feel like if I practice yoga every day, I can be more, I do feel some tightness in my spine in once in a while, and I feel like if I do these stretches, yoga poses every day, I may not have that tightness in my spine, and I feel more relaxed. And any time you most of the senior citizens I see have hamstring tightness, quadriceps tightness,
Mhm.
again, sciatica, which is a result of piriformis muscle tightness. I mean, not necessarily only that, but that's part of it. It can be, as you said, disc bulge is causing the sciatica. So if any person develops a daily routine, exercising daily, exercising doesn't mean just walking. You do have to include strength training. You do have to include stretching. You do have to include cardio. Based on your age and your ability, you don't have to do really like an hour of cardio. It can be as simple as 10 minutes, whatever you can do, like walking at a faster pace than regular just slow walking. That increases your heart rate. Doing a staircase increases your heart rate. So that can be your cardio. And that's that has to be a routine. You have to do it every, on a daily basis, or at least a regular basis, 3 to 5 times a week, or if you can do 7 days a week, that's great. So that's a mindset you have to develop to improve your quality of life. If you don't put effort into it, you can't improve your quality of life. So you have to narrow down, like I want to give my personal example because i I'm practicing, and I want to tell people what I practice, and how effective it is. Without practicing, if I don't practice and if I tell, it may not be as effective. um, so that's the reason, I want to do a cardio, but I don't have time to do like an hour of cardio every day. I'm not, at least, maybe I shouldn't say I don't have time. I may not as enjoy spending an hour on a treadmill, or going for a run, because that's
Mhm.
not me. So what I started doing is, on YouTube, I followed fitness trainers, what they're doing. And I found one guy who teaches a 7-minute workout, and I loved it. And there are 11 or 15 poses, 15 exercise that he teaches you in 7 minutes. And I stuck to it. I loved it. And I still do 7-minute workouts, and that's fast paced cardio. And even though it is 7 minutes, I enjoy doing that. So I'm not spending an hour on treadmill. Rather, I would be willing to do every day 7 minutes, which is better than thinking I want to do an hour of exercise but not doing it. Right? How good
Right.
is that? If I want to, if my mindset is I want to do an hour of exercise every day, I won't be able to achieve that goal. I mean, that's good. I'm not saying that's a bad thing if you can do an hour of exercise, but I concise it to 7 minutes because it's working for me. So I'm
Mhm.
doing every day, 7 minutes a day. Why not? Right? So that's the mindset. I'm trying to concise it, to narrow it down to see what is really effective for me. And I think that's great. 7 minutes, a day, every day. And I do so many other things as well. It's not just cardio. If I spend an hour on cardio, like just treadmill, I'm missing out on other things, right?
Mhm.
So that's why I still, I work on strength training. I do yoga, I do cardio. So 7 minutes, whatever you can tolerate, even if it is 5 minutes,
Mhm.
that's great. So that's how the mindset should be. Even for elderly people, it's the same. Whatever you can tolerate, be it 5 minutes, stick to it, do it every day over a longer period of time. That will change your mindset and you become more physically active. I think that's the key to improving the mindset and quality of life. All right.
Yeah. Yeah,
Yeah,
I agree with that. That's something I like you brought up, the simplicity of it, the time. You brought up the tolerance of it. And yeah, those are things I really discuss with my patients is say, when we're doing something, let's not make it harder than it is right now. Let's just keep it simple. And then one of the key things that I mentioned is getting it where you can spread it throughout the day, that you have it throughout the day that you're doing it. And you don't need to set aside an hour and say, okay, I'm going to do my exercises and then call it good. I refer, like, we don't want to treat our exercises like we're doing the dishes, like get it over with and done. And then, okay, get back to sitting in the chair the rest of the day or something. And so it's like, spread it throughout the day. Don't make it all in one time, just
yes,
throughout the day. And that's putting ourselves in a mindset that, hey, I can do this. And then we're putting ourselves in an environment that the body's going to want to adapt to without overwhelming it. And I think when we do that, then we get that habit, we get that routine. And
that's
then when it becomes easier, then yeah, now's the appropriate time to, okay, let's bump it up a bit.
that's right. Yep. That's exactly what that's how I'm improving my day-to-day workouts and activity. Yeah, great. Thank you, Ryan. And the next topic is rheumatoid arthritis. So, um, I have seen so many patients, and one of my close friends' dad used to have rheumatoid arthritis. I've seen him several times. The most of the time, if it is chronic and progressing, the fingers start to deform. The shape of the joints deform in rheumatoid arthritis because of chronic. It's a severe. It is in a way, it starts as osteoarthritis, but it's much more chronic, much more severe. So the joints deform, and it's called wind swift deformity. People start seeing swan neck deformity, where the index finger, or the fingers become stiff. The joints become stiff. They won't be able to use them without. They won't be able to bend them. So that is the severe condition. But there are so many people that have pains but not joint deformities in the earlier phases of rheumatoid arthritis. How to do you have you seen any patients with rheumatoid arthritis, and what do you teach for those people that are progressing but not quite there where the joints are deformed?
Yeah, big thing with arthritis is the motion is lotion, and that's how the joints get their nutrients is through movement, and depending, sometimes impactability, like walking and stuff. That's getting the movement, but or the nutrients through that. But when we do that, arthritic patients and individuals that have that, it's about tolerance. It's about, okay, just do what you tolerate, listen to your body. I avoid saying, okay, let's do 10 repetitions. I say, let's just do what you tolerate. Don't max it out. Don't stretch it out. When your body feels like, okay, I could probably do about 3 or 4 more of these, I say, okay, that's a good time to stop. Let it relax a little bit, rest for a minute or so, and then do that movement again. And then a lot of times the second time around, it's a little easier. There's a little bit more movement in. And then that's just something that needs to be done kind of throughout the day, just to help that situation with that. And so that's where I mostly focus on, you know,
The
in that
movement.
stage.
Yeah.
Yeah.
I believe, Tai Chi can be a good one, and because it's
Mhm.
a flow of movement.
Mhm.
Swati can, talk more about it in the later videos. And I feel like, the any type of arthritis, rheumatoid or osteoarthritis, there will be inflammation in the joints. When you feel the joints, you feel warmer than normal. Especially osteoarthritis, I feel the joints right and left. Like I had a patient yesterday that had arthritis in the right knee, so I felt both knees, and the left one was much cooler than the right one, and I knew it was arthritis. It was warmer and different from the left, and a little more swollen. So that's another big problem: swelling in joints, increased temperature, pain. So you need to bring that down by talking to your doctors about how to decrease inflammation. So sometimes, doctors recommend taking ibuprofen, which is a NSAID that decreases inflammation in your body and relieves pain. Or they may prescribe another medication that is appropriate for you. So talk to the doctors about severe pains. And another thing is cold. If you take, I know a lot of people don't like cold showers, but cold showers can improve your pain levels. So it
Mhm.
decreases pain levels and decreases inflammation. So based on wherever you are, the cold in United States, especially northern parts, is different from cold in India, where people are, the cold is like, uh, even if it was, 70 degrees, 80 degrees, people may feel like it's cold in India
Mhm. Yeah.
because the higher temperatures, usually they are over 100, degrees Fahrenheit in the summertime. So it depends on where you are. You can still take colder showers and may feel, less pain, especially with arthritic conditions, which are chronic and last, throughout. It may last. It is not something you can reversible. I don't think it is reversible yet. I know there are some treatments coming up like stem cell therapies where they can reverse the degeneration and improve quality of life, but we are not quite there, I think. So in the future, hopefully those can be resolved with less pain. People can enjoy more activities.
Mhm.
All right, I think that's our time. We did more than 20 minutes. Thank you very much for everyone watching. And please do comment where you're watching from. Even after the live session, please comment what you liked about the video, or what topics you want us to talk about in the future videos. We are going live every Wednesday. We are trying to do, I think mornings in United States is working around 6 o'clock in the Wednesday mornings. That's what we will stick to for now. Ryan, myself, and Swati, we three will try to, whoever is available, we will come live and try to um, give some good information about health, wellness, and quality of life. So please bear with us while we are learning all this, and appreciate all your patience and encouragement. Please do comment, um, give us feedback. Thank you very much. Have a
All
good
right.
day. Bye bye.
Thank you.
Thanks, Ryan. Bye.